race for a vaccine or a cure is continuing. So here to talk about the virus and how antibody testing works, this idea of herd immunity, is family physician and CEO of Kind Health Group, Dr. Georgine Nanos. Dr. Nanos, good to see you.
Hi, Lauren. Good morning. Good to see you too.
So let's talk about first this antibody testing and how that can help us achieve this concept of herd immunity and how much testing we really need.
So we need a lot of testing, and we're a little bit behind in that, as we know. So there's two kinds of tests out there. There's the PCR test, which is the nose and throat swab that's been out for over a month now, and that tells us if you have the virus at that time that it's taken, the sample is taken. But it takes anywhere from 3 to sometimes even 7 to 10 days to come back. Another kind of test, that the one that we all really are hoping for now, is something called an antibody test. And an antibody is your body's immune response to a disease. And so there's two kinds of antibodies that form. And these antibody tests can be done very quickly, oftentimes, with a 15-minute turnaround. And so that's why we are very eager to get all these on in wide distribution. So two kinds of antibodies: an IgG antibody, which tells you if you've been previously infected or exposed or have been vaccinated, and an IgM antibody, which tells you if you're infected in that moment and currently have the disease. So, and if it's a finger stick, and it's done it's done at the time that you see the patient in front of you, and you get a 15-minute result. And so that's having that information for a lot of the population will really help us make better better decisions.
Exactly, and really see how many people may be immune, if you can be immune. We'll get to that in a second. But
yes.
I want to talk about this, the reliability of the test, because a number of reports have come out that say it's 60 to 90% accurate, and that's obviously a big discrepancy area. How much can we rely on the antibody tests as of right now?
As of right now, I honestly wouldn't rely on any of them at all, because there's no way to tell which ones are good and which ones are bad on the market right now today. What happened is, about 4 weeks ago, the FDA did a fast track emergency approval for a number of these companies to get their product out on the market, but they didn't have any scientific oversight of those products. And so what's happened is you've got a lot of them that are just not valid or reliable at all. Some of them that are less reliable than they should be, and then at the same time you've got some people who have put some fake products out on the market to just make a buck. So, and they all look almost identical. So it's very hard, even for doctors, to distinguish what's what. So what we're waiting for is for larger lab manufacturers like LabCorp, who I've been talking with regularly, to do really good scientific studies and come up with the good tests. And so that's going to be the game changer when those come out. LabCorp.
Well, thank you for clarifying that, because I wouldn't trust them at all. Was it very assuring at this point? But there is hope for those tests to come. But I want to go back to that idea of having the antibodies and being immune. Does that mean if you've had, because there's been conflicting studies again on this, but does it mean that if you've had coronavirus and have recovered, or if you have those antibodies from a reliable test, that this will not be something that we see every flu season, that you sort of have a built-up immunity to coronavirus?
I wish I had a great answer for you. I don't think we know yet, because we haven't tested enough people. We haven't seen enough immunity and data. We don't know how long immunity lasts. It may end up being like the flu, where you've got immunity for one season but not for the next. So we honestly don't know, because we just don't have that testing data yet. But I think once we do get everyone tested in a more widespread way, then we will have more information. But I think it's not something we can accurately predict right now.
Are we getting any better at the current coronavirus testing capacity? Because the size of San Diego County and the amount of people that we have here, we have been, it seems, significantly underserviced as far as the testing capacity. Are we seeing improvements in that? Are we getting more tests in?
Well, the testing, we have lots of the PCR tests. The first test I talked about with this is the nasal swab, but that only tells you if you're currently infected and not if you've been previously infected. In terms of the antibody tests, I think everyone's in the same situation nationwide, that there haven't been enough of these tests. So it's really a national problem, not just San Diego.
Yeah. Dr. Nanos, thank you so much. Appreciate it, and hopefully we can start to get more testing and more reliable testing out there. But I appreciate your time this morning.
Thank you, Lauren.
Well, the city of San Diego